is Dan. Good morning, Dan.
Good morning.
So I believe you completed your dental implant process a little while ago. Is that correct?
Right. About 3 or 4 months ago.
Wonderful. And you had indicated earlier that you wouldn't mind sharing your story about how all of this came about.
Yeah, let me tell you what happened. About a year and a half ago, I was out walking, exercise, and I slipped and fell. Never thought anything about it, but I had bruises and what have you, but never thought about what I might have done to my teeth. 6 months after that, all of a sudden my tooth was wiggling just like a baby tooth. And I said, obviously something's wrong. Went to my dentist. I live in Houston, and my dentist in Houston said, well, here's the thing. We can either pull it down some and then try to put a crown over it, or actually pull down the root of the tooth. I'm not explaining it very well, but that's the way he kind of explained it. Or we can go the route of an implant. And I thought, well, the two, the implant made a lot more sense. And so then I was up here for a weekend and worked with you, and you gave us the implant. Worked out great. 3 months I wasn't able to really chew on the tooth, but other than that, it's been very easy. And went back down to my dentist in Houston, who did the final crown on the tooth, but the implant was all done here by you.
Outstanding. So after you completed the process, and obviously, a patient look in the mirror and they're trying to assess what have I been through and so forth. Does your new implant tooth, does it look and function like a natural tooth?
Absolutely. From the day one, everything after the implant, immediately it would all acted in just like a normal tooth.
Perfect. Yeah. You indicated that after you fell, when you were walking, and then a while after that the tooth became loose, and obviously that was concern for you. With your new tooth, does it feel stable and secure?
Absolutely. No issues at all with the new tooth.
And let's just say maybe even either in your business life or in social settings, are you comfortable and you have the confidence, self-confidence that there's nothing artificial there and so forth?
Yeah, and I'm an attorney. I work with the public all the time in business settings and what have you, and I've never felt uncomfortable about my new tooth based on the implant.
Wonderful. So Dan, just a final question, if I might. If you were to encounter someone who may be considering undergoing a similar process to yours, what would you suggest to them?
I'd definitely suggest, if you need to have an implant, you have to have something done with your tooth which involves this. I would strongly recommend going the route of an implant. Absolutely, unequivocally.
Wonderful. Well, Dan, I just have had the opportunity to see you through the entire process, and now we're looking at the end result, and I just think that it is a really nice result, and I certainly appreciate the opportunity to work with your family dentist there in the Houston area. So lastly, I just want to thank you for the opportunity to have partnered with you and your dentist to achieve this goal.
Thanks a lot, Steve.